So the breathing exercise, the first one that I'm going to have you do is to decongest the nose. It's very, very simple. Now, if any of the females are pregnant, please don't do it. If you actually do have obstructive sleep apnea, please don't do it. Or if you're doing it, go lightly. I don't want you holding your breath during the day if you're already holding your breath during your sleep. If you have any cardiovascular issues as well, please don't do it. But other than that, it's pretty safe. As individuals, holding the breath is a very natural thing to do. Anytime you go swimming, you're going to stay underwater for a period of time. But holding of the breath decongests the nose. Now, a very simple way to determine which nostril is more obstructed than the other is simply block one nostril and breathe through it. And then switch and block one nostril and breathe through it. So instead of the fogging test, we just have you do that. It'll give you some insight. And I would like you to practice this. Now, the key to decongesting the nose is to hold your breath for a period until you create a medium to strong air shortage. Ideally, it will be about 30 seconds plus. So the objective is for you to take a small, gentle breath in. I like everybody to practice it. A small, gentle breath in through your nose, a small, gentle breath out through your nose, pinch your nose, and gently nod your head, holding your breath. And continue holding your breath until you feel a medium to strong air shortage. Continue holding your breath until you feel a medium to strong air shortage. You can go easy on your neck, maybe just even move your body about, but at the end of it, make sure you breathe through your nose. Now, as you hold your breath, carbon dioxide builds up in the blood, and it seems to be carbon dioxide that's causing the dilating of the nasal cavity. But it's also activating sympathetic tone. Activation of the sympathetic nervous system may also be helping to decongest the nose, because physical exercise will open up your nose. If you do physical exercise, your nose will open. It will run a little bit, but it will also open. Now, you have to practice this 5 times, and I'm going to have you do it as a group, is to practice it 5 times. So you do it once, wait about a half a minute to a minute, do it again. Now, we teach this to children from 5 years of age upwards. In Hong Kong, I was in a hospital in the rounds, and a little kid comes in with adenoid face, and the whole face is sank downwards, and one of her nostrils completely blocked and the other nostril partially blocked. We had her do this. In 5 minutes, we can decongest the nose. It's very easy to decongest the nose. And what's more, when you start bringing breathing volume down towards normal, the nose will remain more permanently decongested. So let's try again. Take a normal breath in through your nose, a normal breath out through your nose, pinch your nose, and gently nod your head, and hold your breath, and hold your breath for as long as you can. I need you to hold your breath for as long as you can. So continue to hold your breath for as long as you can. Continue holding your breath. And when you feel a fairly strong need to breathe, to let go and to breathe through the nose. Now, another thing that can be quite useful there is when you hold your breath, you'll start to feel your diaphragm kick or contract, because at some point the brain is sensing there's a changes in blood gases, and the diaphragm is also sensing discomfort. So there's messages coming from the brain via the phrenic nerve to the diaphragm, and the diaphragm is starting to innervate. You're starting to give it a workout. If we go around with our mouth open, we primarily use the upper parts of the lungs. The diaphragm can become stiff. It's difficult to get in at the diaphragm. It's our main breathing muscle. But holding the breath can improve respiratory muscle strength by innervating the diaphragm. Can we try that exercise again? Take a small breath in through your nose, a small breath out through your nose, pinch your nose, and I'd like you to hold your breath, and hold your breath for as long as you can. So continue to hold your breath for as long as you can. And it's better if you move. It's better if you move. Hold your breath for as long as you can. I need you to experience the effect of, as you hold your breath, carbon dioxide is increasing in the blood, and carbon dioxide is helping to open up, dilate the nasal passages. So at the end of it, make sure you breathe through your nose and calm down your breathing. And I'm going to do it 2 more times. You can even check your nostrils there. Check your left nostril and check your right nostril. Some of you will start to experience some changes there after 3, but ideally you need to do it 5 times. Now, the individual who's coughing, when you hold your breath, you will have dilation of the lower airways as well. Mucus that's trapped will start to come up. But the other thing is, if you hold your breath for too long and if you take big breaths at the end of it, the hyperventilation could just trigger the cough. But that's your symptom. It's easy to address it if you change your breathing. Can we try that exercise again? Small breath in through your nose, small breath out through your nose. Pinch your nose and hold your breath, and hold your breath for as long as you can. Hold your breath for as long as you can. And the key is to keep relaxing into your body as you hold your breath. Keep relaxing into your body as you hold your breath. To decongest the nose, you have to hold it for a medium to strong air shortage. For a medium to strong air shortage. Okay, so I would be comfortable enough. Just check one nostril and then check the other nostril. Is there anybody with quite severely blocked nose at the moment? You have. Can I try something else with you? Okay, would you mind coming up to the top? You'll be probably regretting it now. You don't have sleep apnea, high blood pressure, nothing, no?
No.
Okay. So if you block one nostril, breathe through it.
The one that's open or the one that's blocked?
Try. That's quite blocked. And try the other one. Okay, so the left nostril here is very blocked. Now, if it's a complete deviated septum or polyps, I can't do much about it. But if, for instance, the nose unblocking exercise that we just did, if that doesn't work, we try a different approach that's slightly stronger. By the way, can I just see those of you, a show of hands, who feel their nose is starting to open as a result of doing the exercise? So it's quite positive. It's better.
But it's still.
So I'm going to have you stand down, Richard. And I'd like you to just take a small breath into your nose. Now, by the way, no stress with this, yeah? So small breath into your nose, small breath out. Pinch your nose, and now walk as many paces as you can. Just walk as many paces as you can. And keep relaxing into your body. And maybe turn back up this way. And I need you to kind of push it a little bit. But at the end, don't overdo it, but make sure you breathe through your nose. Keep holding the breath. Keep holding the breath. Keep holding the breath. When you feel a fairly strong air shortage, let go. Let go now. Breathe through your nose, calm your breathing. Calm your breathing, and then you can just rest at that. And now try the nostril. Is there any change there?
It's improved.
Yes. So there's something physical there. And you know that. Well, I can't fix that.
It's not always as bad.
But thanks. Yeah, no, but that's... What we can do is we can help reversible obstruction or rhinitis. But if it's physical... And I'll explain it, but thanks very much. I have a deviated septum. It's very, very badly deviated. Dr. Hang can verify. He's done cone beams and he's looked and he says, oh my God, your nose is all over the place. But the human body is very resilient. When you change your breathing volume, you're not trying to force that big volume of air through it. When you bring your volume down towards normal, I'd say most of us here, to a lesser degree or more, have some deviation of the septum, you know, so it's very, very common. But doing this exercise here will work for somebody with chronic rhinitis. Now, it'll work temporarily. It's when you start changing your breathing, you'll get a more permanent change. Japanese study. Results suggest that breath holding increased the nasal volume due to shrinkage of the nasal membrane promptly and evenly within the nasal cavity. Now, of course, the paper is in Japanese, so I can't give you the translation there. This paper here, this is going back to 1923. This has been known for a long, long time. Nasal airway resistance was decreased during breath holding in man and during experimentally induced asphyxia in animals. Now, I've used that exercise on about 7,000 to 8,000 individuals, including children. We can get the nose decongested in 5 minutes. And if you practice that along with other exercises, including breathing through the nose, if you need to get your nose working, we have to breathe through the nose on a continuous basis. It's not just enough just to do the exercise. In this paper here, when nasal breathing takes place in the presence of significant obstruction, there's an increase in the pressure of carbon dioxide and a decrease in oxygen and a decrease in nasal airway resistance. In other words, if you've got a partially blocked nose and if you continue to breathe through it, the nose will actually start opening up. Now, it's easier for us when we're doing the exercises in tandem, because you don't want to be, it's quite uncomfortable to breathe through a partially blocked nose, but generally one nostril is a little bit more blocked than the other, and they'll change every 90 minutes. And when you lie down at night, the nostril that's closest to the pillow becomes more blocked, and that's why we switch position and we change it from left to right and vice versa. But breathing through the nose is key. Now, I wrote this in an airway forum, and I said it was my experience. I didn't have this paper at the time. I wrote it about a month ago, and I said it was my experience that when individuals start breathing through the nose actually starts working better. And there was an ear, nose, and throat there, consultant, and he said, in my 17 years of practice, he says, this is something that, I have never seen. So in other words, he doubted me. But I have seen it with thousands of individuals, and even having just one paper, But the key is, there's no side effects from teaching somebody to breathe through the nose. First do, no harm.